Right. Hi, everybody. Welcome back to the Get Healthy Tampa Bay podcast. I'm your host, Dr. Kerry Reller, and today we have a very special guest, Dr. Michael Massey. Welcome to the podcast. I just discovered that we're new neighbors in the Palm Harbor area. So will be very exciting to hear all about who you are and what you do. So why don't you tell us a little bit about that?
Sure. So I grew up in Sacramento, California. So I'm a transplant to Florida. I went to med school in Kansas City. I did my training in physical medicine and rehabilitation in Chicago. After that, I did a fellowship in pain medicine in Seattle at University of Washington. And I was hired by a hospital system out in Minnesota to roll out a pain service line. They were kind of like a Baycare or an Advent Health, and did that for about 5 years, scouted out the space, rolled out the whole service line. And after about 5 years, we'd had enough of Minnesota and decided to move to Florida. My wife's family's in Florida, and came to Florida, and I worked with an orthopedic group for about 2 years as the medical director of interventional pain medicine. And then an opportunity came up where we kind of decided to part ways amicably. We're still great friends, still refer to each other. And I started a practice called Gulf Coast Pain Care. We specialize in comprehensive pain medicine in the Palm Harbor area. And I also am the founder and CEO of MedLCP, and that's a medical legal firm where we do life care plans, independent medical evaluations, file reviews, that kind of thing.
That's pretty cool. I did dabble in that website. I was very interested in that too, but I think we'll focus on the pain part today. So you've literally lived like all over the country, and I can definitely see why you moved from Minnesota to Florida. I don't think I could handle it.
Yeah, it gets pretty cold in
Yeah.
Minnesota for over half the year.
Yeah, I did spend a summer there once, and that was tolerable. And I
Mhm.
almost took a job before I went to med school at Medtronic in I guess medical device sales and things. And I chickened out because I didn't want to move to Minnesota. I didn't think I could
Yeah,
handle
that's funny. My brother had a similar experience where I was, should I go to med school? Should I not go to med school? And I talked to my brother about it because he's in sales and tech sales. And he said, Mike, I don't think you'd be good at sales. And I was like, well, what? Well, why? I think I'd be good in sales. And he said, you're just not very good at kissing butt. And, you would just want to tell them what you really think. And it probably wouldn't be good for selling. And so I just don't think you would do a good job. And I was like, oh, okay. Well, thanks for the feedback, bro. And that was, I think, good advice. And medicine's been good and good to me.
Yeah, that's definitely good advice. I'm glad he told you like it is. So that's perfect. So Gulf Coast Pain Care, is that what you said? Gulf Coast
That's
Pain Care.
correct.
Yeah, awesome. Okay. So what made you from in medicine in general, what made you want to like focus in on pain?
Sure. So when I was 16 in California, I did everything. I played a lot of sports. I played football. I played volleyball. Volleyball is big in California. I lifted weights. And when I was about 16, I had an experience where I had awful low back pain. And I didn't know what it was. And I felt pain going down my leg. And it was really weird. It was the first time I've ever experienced anything like that. And I went to a orthopedic physician, and he ended up getting an MRI of my back, and it showed that I had a herniated disc. And he came up to me and my dad and said, Mike, you have a herniated disc, and that's why you're having all of this pain in your back and pain going down your leg. And unfortunately, we need to do surgery on your back. And I was looking at him and I said, that's just not happening, man. What else can we do other than that? And he said, well, that's what I recommend. I was like, well, I'm not doing that. So what else do you have? And he said, well, I guess physical therapy. And then he walked out. And so I did that. I went to physical therapy and got an idea of what that's like. And I was put on some medications, and the pain was still there. It was still bugging me. And I was very lucky because at the time, pain medicine was kind of a relatively new field at the time. And I actually had an uncle that was at Stanford, and he was in the pain medicine program at Stanford. And I talked to him and I said, hey, man, this guy's saying I should get surgery. What do you think? And he said, I think it's a very bad idea. Did he talk to you about the long-term implications of a 16-year-old having surgery on his back? And I said, no, he just said I should do it. And he said, well, what'd you say? I said, I'm not doing it. I want to do physical therapy, something else. He says, well, that's the right thing to do because you're 16. There are reasons to have surgery, but do you have weakness in your leg? I said, no, I can walk just fine. Or do you have progressive weakness, anything like that? No. And he said, okay, then don't have surgery. It'll go away eventually. It's just going to take a long time. And so that kind of set the ball in motion of me getting into pain medicine. And I had other experiences where I had massive flare-ups of back pain. And when I was 20, when I was 25, and they were bad, And so I got a pretty good idea of what patients go through when they have severe pain conditions. And I also got a taste of how our healthcare system is set up and how they treat patients that have the same type of conditions I have. And it's very hard to navigate. And so when I went through that whole experience, I said, I would really like to be able to just help people that had the same type of conditions that I went through. So that way, not everybody's going to go through with maybe a procedure or treatment that might end them up in a spot where they are just struggling with it the rest of their life.
I mean, that story is so profound. I didn't expect you to say that. So that's amazing what obviously going through things and having your personal experience puts a whole new light on everything, right? I think that's very awesome. And then, like you said, pain is like kind of a newer field. It's interesting that you were exposed to it by your uncle. That's kind of very lucky that you had that like opportunity so you can get that reassurance that yeah, you don't have to do surgery, especially in your case, and you're were a super active teenager and individual that needed to not just go to surgery. So how did you overcome that? Did you have any like procedure at all, or did you just do everything possible other than that?
So when I was 16, I did a lot of physical therapy. And in physical therapy, we did traction, we did ultrasound, we did structured exercise therapies, manual therapies. And it really took a long time for it to get better. The thing that I think people need to understand is that when you have this type of injury, it's not like normal muscle strains where it takes about 4 to 6 weeks and then you feel better. Disc herniations can take a very long time to feel better. And so it took me over a year, really, to start feeling kind of better and then understanding what exercises I need to do to feel normal. And so that was the first time around. The second time around, I was playing basketball when I was 20, and I felt some pressure in my back. And then it just started to keep building and keep building. And then it brought me to my knees, and I was on the ground, and it was bad. And I knew I probably had another flare up or an aggravation of a disc herniation. And I got chiropractic care. I went and got physical therapy. I got something called an epidural steroid injection, and that was helpful. It was still kind of there, but that was helpful. But one of the mainstay treatments that helped me was just good rehab, just doing the right
Mhm.
types of exercises to bring my pain along and slowly get better. I think having realistic expectations of the process helped me because when I first had it and when I was going through the process, I just wanted someone to tell me, okay, is this ever going to get better? Because this is really hurting and it's taken a long time to get better. And what helped me is having like my uncle or other providers that would coach me up and explain to me this is normal. I mean, it's normal that it takes a long time for this to get better, for the rehab to take better. And that's very helpful and honest with people. You don't want to just jump to a procedure or jump to a medicine if you really want to try to go about the healthy way of kind of rehabbing this yourself. And so that's been really good for me is rehab.
Yeah, and obviously I think that's really important, like you mentioned, setting expectations, right, for any condition, right? To know that it's not just going to be, oh, you did this and you're going to be better in like a month or a week or whatever. So that's really, yeah, that's helpful. So what would you say everybody should know about pain? I think that's kind of what we were going to talk about a little bit broadly or maybe specific, I don't know, but let's just start there. What should everybody know about it?
I think people should understand that pain is a very personalized experience, that everybody has their own unique experience when it comes to pain. For example, and you can probably appreciate this, if I see a patient in clinic and they broke their arm, and someone comes in and another patient comes in with that same injury, they will most often have two completely different pain experiences. One patient might come in with a broken arm, and I'll ask, "Hey, how's your arm feel?" They say, "Yeah, it hurts, but I mean, whatever." And I'll say, "Okay, I guess go to the orthopedist and here's some Tylenol. See you later." And then another patient will come in with the same exact fracture, and they are wailing, they're crying, they're begging me for me to do something to help them. And the main takeaway that I get from seeing, and I see this all the time, where people will come in with the same type of injury or disease, medical disease, and they'll have different pain experiences. And you got to treat the patient where they're at and kind of go from there. And so you can't just assume one injury will have one certain pain response. You have to realize that people are individuals, they have their own experiences and their own genetics that kind of contribute to whatever experience they have with pain.
Mm-hmm. Yeah, I would kind of define as a wimp, I think. So I have a feeling like if I'm going to be, falling or crying or anything, where I definitely, another person maybe on my soccer team or something would have the same thing and they would be perfectly fine. So I don't know, but
Yeah.
that's interesting. Yeah. And I think even with medicine, with like, say, I do a lot of weight management, everything is such an individualized approach and so important to take, meeting a patient where they are and, seeing what works for them because everything is going to be different. So I didn't realize that was so much in the pain, I guess, arena as well. Yeah. So everyone, like you said, experiences pain at some point. So how can you approach pain in a healthy way?
So I think the first thing to remember whenever someone has, for example, an acute episode of low back pain, that's, most of what I see is neck pain and low back pain. The first thing I try to tell patients is don't freak out and understand that a lot of people most people experience severe low back pain, severe neck pain at some point in their lives. And really just to understand what the red flags are and what they're not. So if somebody has severe low back pain, that's not necessarily a red flag. That's just your body telling you something's wrong with your back. A red flag would be if somebody has weakness in their arm or weakness in their leg. That's never normal. And anytime that happens, you should go to the emergency room or your primary care physician or somebody to get an evaluation immediately to make sure that there's no emergency going on with your spine. The healthy ways that I try to coach patients on how to address their pain are to, one, understand it, get a really good diagnosis. Is this a critical issue that needs surgery? And sometimes it does need surgery. Sometimes pain issues in the neck or in the spine, in the back, do need surgery. And once that's kind of ruled out, usually we try to motivate patients to start addressing it with either physical therapy or chiropractic care to get a little bit of help or coaching on maybe some exercises they can do. So when I have patients go to the physical therapist, for example, I like the physical therapist to show them what exercises to do and then have the patient demonstrate how to do those exercises to the physical therapist. And then the physical therapist will coach them up on doing it correctly. And then they go home and they do it independently. The big tagline that I try to give most of my patients is motion is lotion. We try to say, try to walk, try to move around. Most of the time, bed rest is bad. Most of the time, moving around is good as best you can. And you don't have to force it. Like if you're moving around and it really hurts, then, don't do that. Try to do what your body will give you. There's actually different techniques in physical therapy that could be employed called McKenzie exercises. And McKenzie exercise techniques are when you basically do exercises that don't hurt. You should not fight the pain. When you have an acute episode of pain, you should do things that don't necessarily exacerbate the pain. That's not good. And by the way, here's another thing. If you ever go to a physical therapist or somebody and they say, you need to fight through this pain, this is what you need to do, that's not necessarily good advice. And I would check with your doctor, your provider, to make sure that you're getting good advice from your rehab specialist. Medicines are okay every once in a while. I like Tylenol. I think Tylenol is great. I don't think
Mhm.
it's necessarily good to take too many pills. But if you are going to take a pill, make sure you check with your doctor so that way you take it correctly, because sometimes there are times when you should not take certain medicines depending on your particular condition. And really just kind of go from there. There's also some cool diets that you can take when you're in pain. There's some anti-inflammatory diets, and that can be helpful. There's certain supplements you can take. For example, magnesium is really good for pain. And also just talking to the right people. You want to make sure that whoever you get information from, it's not from someone who's obviously trying to sell you something. You want to get some information from a provider you trust, and then do it and see how it goes. And then follow up with them and seeing, okay, are things going normally or is something wrong? Do we need to change up our strategy? So to me, that's kind of a comprehensive approach to how to treat pain in a healthy way.
I like that you bring up, dietary and supplement things too, because there's definitely ways that patients will actually have true inflammatory markers circulating their body based upon all the foods that they're consuming. And they could feel a lot better and different if they weren't doing that. So I think that's interesting. How does magnesium play a role in the pain cascade?
Magnesium is excellent for patients that have muscle pain. So when
Oh.
patients have acute pain issues, you typically have a lot of muscle spasms. It's very good for headaches. If somebody has upper back pain, neck pain, and they get tension headaches, that's
Mhm.
one of the most common supplements that's used by pain physicians and headache physicians to help prevent headaches, kind of calm the nerves down, the muscles down. It also has a calming effect on your brain. It calms you down. So medicine's very good for that. Another thing, it could be a good thing or a bad thing, it helps to make your
Wow.
bowels a little bit more loose. And so if you are someone that suffers from constipation, it's usually a good one to start to help loosen the bowels a little bit. If you're going to the back, if you're running to the toilet all the time, yeah, you might want to back off a few doses of magnesium because you don't want to, take magnesium, no matter what. So, that's just an example. There's a bunch of other cool supplements you can do for a variety of pain conditions, and there's a lot of diets out there. There's anti-inflammatory diets to kind of try to address the pain issue in a healthy way.
Yeah, I actually take magnesium myself, and I'm sure our mutual colleague will will comment on this. But I have migraines, so I was, I just heard that it's good for that. So I definitely know that it can be helpful for migraines. So I take it and I take it before bedtime, so it helps with sleep and things like that too. Yeah.
So when I mentioned earlier, I trained at University of Washington, and there was this gal there. She was the medical director of the headache clinic, and it took about a year to see her. And I had the privilege of training with her, and I basically do what she taught me. And one of the big things that she taught me was she gave me a list of all these supplements, and she showed me all these supplements to give to people. And usually it just works. And every once in a while, though, I'll have a patient I'm really struggling with, and I'll reach out to her and I'll say, "Hey, I got this patient and she still has headaches. Do you have any ideas?" And the first thing she'll say is, "Mike, do you have them on all the supplements?" And I'll say, "No." And she'll say, "Okay, well, get them on all the supplements and then call me back, if there's still issues." I was like, "Okay." And usually, usually that's it. Usually it's just kind of getting them to come along and get on the supplements is usually the way to go. And I know for people that have never really been on supplements or think that's a little extra, it is a lot. So when you get into headaches, for example, there's a lot of stuff that goes into treating headaches. And it's really funny though, because doing just a few changes in your medications can go a long way in helping with headaches in particular.
Yeah. You mentioned earlier motion is lotion. I don't know if you want to expand on that a little bit, just because I think it's a very important concept when dealing with most like acute or chronic pain.
So almost every injury makes you feel like you don't want to move. So like if you have like a back pain, you don't want to move. It hurts. Hurting, moving hurts. And it's okay to rest and heal up a little bit, but you really do want to move around. Our bodies are meant to move around. And when you don't move, bad things happen. For example, let's say you decide to stay in bed for a week if you have an acute episode of low back pain. What's going to happen is you're going to lose muscle. You're just going to feel groggy. Your sleep's kind of probably going to be off. You're going to probably gain weight, and it's just not good. All these other little health problems start to develop. Whereas if you keep it in your head, I'm going to try to move as much as I can, but give myself a break here and there, that usually yields better outcomes. And sometimes you have to do things like get in the pool to kind of, move around. Sometimes just little general range of motion, just doing whatever you got to do to move around. That usually yields better outcomes. And when we exercise, our body does a lot of cool things to reward us, to let us know that's good for you. That's how we get our dopamine. That's how we get endorphins. Those are good things. And that's how we want to get dopamine and endorphins. We don't want to do it in a cheating way where we take, just drugs or do things that are unhealthy to get those pops of dopamine and endorphins.
Yeah, I like that too. Like you are getting this reward from doing physical activity as well. You had talked about these McKenzie exercises and chiropractic care. How do you like incorporate that? Because we don't typically all the time work with chiropractors because I mean, it's just not as traditional, but I mean, I think it's important to know how to do comprehensive care. So how do you work with them on these things?
Sure. So chiropractors are experts of the spine, right? They are experts in the neck and back. And they have a whole lot of modalities that they utilize to treat back pain and neck pain. When I get a patient that's really locked up, for example, let's say their neck and their muscles are just, I mean, they're just tight and they can't even move their head around and it's early. There's a lot of cool things you can do to kind of help loosen up the muscles. We have a colleague you mentioned, Ray, who I send patients to every once in a while for dry needling. And that's one modality you can use where you can literally just stick a needle in muscles to kind of help loosen it up. And that's helpful for a lot of patients. Sometimes patients really need to get a good massage, and that's helpful. Sometimes they need cupping, sometimes acupuncture, sometimes just time. And sometimes there's all these different types of topicals that you can put in. Chiropractors have a lot of tools in their belt, and I utilize chiropractors to kind of help with patients primarily that have, those types of injuries. And frankly, there's some patients that do really well with just getting an adjustment in their neck and back every once in a while. That's helpful too. And
Mhm.
so I utilize kind of I kind of see what's going on with the patient and see what makes the most sense right here. And I have some colleagues that I refer to that I just know what I usually know what I'm going to get out of sending them my patients to them. And so I'll send it to them knowing that we have a good relationship. We speak to each other and then kind of just go from there.
Mhm.
What's not good is if you send a patient to a chiropractor and then they just sit there and do things there forever. One of the challenges of pain medicine is that a lot of times primary care providers, physical therapists, or chiropractors, they'll hold on to patients for way too long. And they'll go there and they'll do treatments passively for a very long time, meaning they're doing something to the patient as opposed to the patient doing exercises, and they're really not getting better. And that's not good. You want to make sure that it's a progressive rehab plan to where they start doing exercises independently and their function continues to improve. If they plateau, that's not good. You want to make sure that they continue to go and then eventually they say goodbye to everybody and they function independently.
So where do you fit in the treatment of back pain, neck pain, like you said, your specialties? Where do you fit in?
Sure. So when someone has an acute pain injury, and let's say they went and saw Dr. Reller, and Dr. Reller did send them to physical therapy with Ray, and they did some physical therapy. And after about 4 weeks, it's just not getting better, and they have pain down their leg, or just they're just not better. Typically, I'll see patients about 4 to 6 weeks after they've had an acute pain injury. They may or may not have imaging in their back, but when I see them, the whole purpose of the evaluation is to determine one, is this a surgical issue? And if it's a surgical issue, if I deem it a surgical issue, then I will make sure that they have the correct imaging for their condition, and I'll send them to a surgeon to get evaluated for a possible surgery. Now, if I think somebody needs surgery, they probably need surgery. There's a lot of camps on how people think about surgery. Surgeons typically think that patients need surgery, a lot sooner than maybe someone like me or other providers. But if I think someone needs surgery, then they most likely need surgery, and I'll send them to surgery. I also will evaluate somebody and determine, is this somebody that might benefit from an interventional pain procedure? There's all different types of pain procedures that can help people in whatever type of pain injury they have or pain condition they have. So the most common thing that pain physicians do for acute low back pain or acute neck pain, and maybe it's going down their arm or leg, is we can do something called an epidural steroid injection. And that's something that we do to kind of help treat the pain. And the purpose of that is not to kind of cure their issue. It's mainly just to facilitate good rehab. A lot of times pain issues interfere with their ability to do good rehab. But if you treat the pain issue, then usually they can participate better in physical therapy or home exercises and kind of go from there. Sometimes patients benefit from medicines. I'm not really a medicine guy, but when I do prescribe medicines, I prescribe the right dose. I want to make sure that we don't do half measures. We prescribe the right dose to treat the issue. So, most patients, when by the time they've seen me, have tried Tylenol or ibuprofen. Actually, it's usually ibuprofen or Aleve. And I try to explain that taking ibuprofen like candy is bad. It could actually be really bad for you. When the opioid discussion started coming up, what happened was a lot of providers just started prescribing everybody NSAIDs, meaning ibuprofen and Aleve. And what they found is all these people started getting all these gastric ulcers and they get into kidney failure. And they said, oh, wait, maybe that's a bad idea. And so they kind of scaled back on that. And we kind of explored like different medicines. But there's still a lot of docs that do that. They still will just continue to tell them, go ahead and take as much ibuprofen as you want or as much Aleve as you want. And so I'll explain to patients and educate them that's bad. That's not good. And they'll say things like, well, I got to treat my inflammation. I was like, sure, but that's not the only way to treat your inflammation. There's other things to do, and that's just bad. And you explain how this can harm them. So medicine, and we talk about other medicines too. Sometimes they need heavy hitters. Sometimes they need to get a course of opioids. And that's not a bad thing if it helps get them to get better. A lot of times I'm talking to them. So my primary specialty is physical medicine and rehabilitation. And so I know a lot about rehab. And I'll talk to them about certain exercises they might want to try out or different supplements, things that they might want to try out. Sometimes they just need a little TLC. Sometimes it's just about you know, educating the patient that this is normal. You're actually doing a good job. They might not feel like they're doing a good job, but just letting them know you're doing a good job. Stay the course, and then kind of go from there. I see a lot of patients that come to me for a consult thinking they're going to need a surgery or thinking they're going to need to, some sort of big procedure. And I will explain to them, you're actually getting a lot better. And if you were my brother or my mom, I would just tell you, keep up with the rehab. You're doing really great. And, circle back. If you need to circle back, we'll talk some more. And, let me know how it goes. See you later, and kind of go from there. I don't think it's good to always just jab people with needles and to just give people surgery if they really don't need it. And so you got to have a very good comprehensive discussion with patients and kind of go from there. One of the benefits of being an independent community physician is I don't have Big Brother talking to me about how we need to get our revenue up. So you might want to offer this spinal cord stimulator or something like that. We can actually have a discussion about what's going on and then go about the treatment in a very healthy way. I also see a lot of second opinions. Sometimes they will be recommended to have surgery, and patients will drop in just for a second opinion. And sometimes I agree that they do need surgery, and sometimes I don't. And so it's a really good spot to be in as an independent community physician because you can do what you feel is right for your patient.
Yeah, I love that. And I think it's nice that you educate them, like when you need to do the epidural injection or something like that, that you're doing it really so that they can continue the physical exercises and the rehab, rather than just, hey, this is going to cure you. So is there any like discussion that makes that a little more difficult, or how do you approach that? Like, so they really know that that's what they need to continue to do?
I can think of one patient in particular when I was in Minnesota who I said to her, I really think you need to have some therapy. And she was set on having surgery. And I said, I really feel like you should do some physical therapy and try it. And she was in tears. I mean, she was bawling. She said, I no, I need surgery. I feel like I need surgery. And my primary care physician thinks I need surgery. And I was like, listen, I respect your primary care physician. I understand why you might feel that way because someone's telling you need surgery and somebody, this or that. But I'm just telling you, I really feel like you're going to get better if you just wait a little bit longer, do some physical therapy, and go from there. And in the meantime, here's some medicines maybe to help you out, to help you with therapy. And let's circle back in a few weeks. And she did it, and she came back, and she wasn't in tears, but she said she thanked me. She said, "Thank you so much for not letting me go and do that surgery." And listen, I'm not like an anti-surgery guy, but there's a lot of surgeries that are being done on patients that probably don't need to be done. And so it's really important that you make sure that patients get a good outcome. It's our responsibility as physicians to, advocate for our patients, make sure that they have the right information, and obviously they can make their own informed decision as opposed to just kind of going along with it and kind of passing them along. there are certain insurance companies that require they see someone like me to kind of tease out, does this person need to have surgery? I want you to see a non-surgical expert before you can have the surgery. And the whole purpose of that is to really have a good conversation with the patient to make sure that they are informed of the risks and benefits of going through with the surgery, and does the timing make sense? So, it's I really enjoy having those conversations because it's an opportunity to really help somebody understand what the decisions they are about to make, the type of implications that they have, and how it could just be a part of the whole process in helping them.
Are there any advice that you would have for someone who's been in pain for like months and hasn't found any relief? What they would do?
Sure. I'd say, well, come see me.
Oh,
I'd
yeah.
say there's lots of different things you can do. And just to kind of talk about real quick the main treatments that are available
Mhm.
for anybody that has any type of pain condition. There's five main treatments. And so the first one is surgery. The first one, when someone's in pain, and sometimes chronic pain is cured by surgery. For example, if somebody has a hip issue and it's been bothering forever, if you get a hip replacement, usually the pain's cured. And so that's an example of how surgery can sometimes cure chronic pain. So is it a surgical issue? Someone's in pain forever. Is there an interventional pain procedure that can help someone's chronic pain? And there's a variety of interventional pain procedures that can help someone's chronic pain. And someone like me would discuss those with them. There's a whole bunch of them. There's different types of medicines, and everybody should be informed of the medicines that are out there and the implications of being on medicine. So, for example, a lot of patients do want strong medicines because their pain hurts so much. And that's very understandable. But if you start certain medicines, like for example, if you start an opioid, if you start hydrocodone or something like that, you have to ask yourself, how long do you want to be on this medicine? And will my provider be able to continue to prescribe it? Because the way healthcare is right now, there's a lot of medicines that are regulated, and doctors can't just prescribe the way they used to. And so it's a little bit different now. Talking about different therapies and really just that's so surgery, interventional pain procedures, medicines, all different types of therapies that includes psychological treatments.
Mhm.
There's a lot of good psychological treatments that are very helpful for a variety of pain conditions. And it kind of blows people away how much it helps when they actually do it. So there's a lot of stuff out there for that. There's all, like we mentioned, the supplements, and we mentioned how, there's all these other different types of procedures. The last thing I'd say is do nothing. The last thing is more about an acceptance, like just accepting the pain. Sorry, it's my dog. Um, this is Fendi.
Hi.
Just accepting the pain and understanding this is going to be a part of my life and I got to learn how to live with it, and just doing healthy things to live with the pain. But yeah, there's a whole lot of stuff that you can do for pain
Mhm.
issues. What's tricky though is that medicine's not very good at curing chronic pain. It's usually something you have to manage. You probably heard the term pain management, and the reason why it's managed is because often we can't cure chronic pain. You have to manage it with those types of things that we just discussed.
Yeah, those are really good points. I also like how you brought up the psychological training or therapy as well, because there's a lot of anxiety and depression that cross over with chronic pain as well, right?
Yeah. So there's probably the most common drug that's prescribed for these types of issues is duloxetine or
Mhm.
Cymbalta. I don't know if you remember the commercials, because depression hurts. And FDA, so Cymbalta is FDA approved for depression. It's FDA approved for anxiety. It's FDA approved for chronic musculoskeletal pain. It's FDA approved for nerve pain. It's like FDA approved for everything. And so we use it a lot in pain medicine. And it's not necessarily because I'm the best, person to prescribe a psychotropic. It's because it helps people with their pain issues. And it also helps with depression. It also helps with anxiety. And we might do a trial of duloxetine for a while and kind of see how that goes. Another cool thing for, we mentioned the psychological treatments is art therapy. So in about around 2010, I think the Department of Defense, they spent a lot of money on our soldiers that came back from Iraq. And one of the big things they did was art therapy. And just to kind of give you an example of how some of the art therapy sessions went, they would have a mask activity. They would take a mask and they would paint the mask. And the instructions were, I want you to paint on the front of the mask how you think the world sees you. And so the participants would paint the mask, and it was usually, very like sunshiny, happy, happy masks. And then said, okay, great. Now go ahead and turn it around. And I want you to paint on the mask how you see yourself. And it was usually different. It was usually a little bit more morbid, a little bit more sad, a little bit more kind of intense. And what happened was, what usually happens in those types of exercises is people have a cathartic experience where they're able to maybe just express how they're feeling. And that makes them feel good. Like that gives them a sense of relief when they're able to do that. A lot of times there's a lot of unresolved experiences that people have that they can't even talk about it. And so you need a medium to be able to kind of get that out. And when there's some sort of unresolved thing that's kind of in you and it kind of presents a certain way. I see patients that do have stuff like this where they have these pain conditions that's obviously related to maybe a horrible trauma that happened to them in the past. And that's, it's really difficult for someone to talk about that. Especially, I mean, you have to have a very good relationship with them. And also you want to talk about it to somebody who really deals with complex trauma. But there's certain little things that they can do that kind of help process that just makes them feel better. And art therapy, I found that art therapy is one of them.
That's so interesting. I haven't heard that at all for pain, so that's really neat. I have, I think, a future episode on someone who is very focused in on trauma therapy and things like that. So maybe that will come up. That's very interesting. What
Mhm.
what I guess what is there anything else you'd like to share before we close? Yeah. Anything you can think of?
I mean, I guess the big thing that I want to share is that whenever you have a major pain issue, that you really need to get good advice and make your options are, and don't just jump to, you know, surgery, don't just jump to medicines, don't just jump to all this. Most of the time, just doing the right therapy or even just time, usually that just kind of takes care of issues. But if you really want to get good advice, you need to talk to a provider that you trust and make sure that you get good advice. There's a lot of cool stuff out there that's available for certain conditions that are really good. And sometimes it's very appropriate. We mentioned the epidural steroid injections, that can be helpful. Kind of a popular thing right now is regenerative medicine. That's kind of an emerging field. And there's a lot of patients that could benefit from certain types of procedures with that, like PRP is something that can be helpful. There's something called prolotherapy. There's all these other regenerative techniques like laser and shockwave. There's all these different things that you can do. But again, it always comes back to speaking with somebody about your condition, getting a good diagnosis, and really just working on slowly improving your function and having realistic expectations about how long it will take for this thing to get better.
Yeah, I mean, one of the things I love about doing this podcast is that I find out all these other resources that can be used to treat different things. And it's just really been enlightening. Like, obviously, the dry needling that we've mentioned, radiation therapy for osteoarthritis and other conditions, things like we don't typically think of. And it's just been really eye opening. So I'm hoping that everybody, takes, a really good listen of what you've been talking about today and kind of apply it to their own life, because like you said, everybody's going to be in pain at some point or another. So if patients want to work with you or find you, where can they do that?
Sure. So you can Google us, Gulf Coast Pain Care. That's our practice. And we're located on Tampa Road at 19. And there's a bunch of little medical facilities in there. There's an MRI place in there. You could give us a call, and happy to work with you. We take a lot of insurances, and we see people for all things pain, any type of pain condition. If you have so we've mentioned mostly neck and back. If you're struggling with a neuropathic pain issue like a nerve injury, happy to talk to you about that. I got a lot of experience with neuropathic pain and treating those conditions. I mean, we have a very great staff. Our staff is very nice. Our goal here is to make sure that you're treated with respect and that you walk out feeling like you have a good understanding of what's going on with you and the best way to get better. And as far as providers go, I do my best to collaborate as best I can with providers. If for surgeons, for example, if people need help perioperatively, happy to help with their patients before and after surgery as needed. Primary care physicians like yourself, if you have any questions about something, happy to curbside, happy to see them in clinic, whatever you want, happy to help.
Awesome. Well, thank you so much for your time today and enlightening us on everything pain. And this has been a great discussion. So thank you. And everybody, please, look for Dr. Massey wherever you can find him if you need him, and or come to me and I'll refer you. But please tune in next week for next week's episode. Take care.
Great. Thank you.